Hello everyone, welcome to our
Hello.
channel. Today's episode is a very special episode. Why we saying it is special? Because we are diving into something that affects every single one's life, and
Okay.
um, and we often neglect it. And what is that we neglect is our oral health.
Mhm.
And to guide us through this, we have my dear friend, Dr. Zina, who's the founder of Perfect Teeth Studio. Dr. Zina Hafin is a cosmetic dental surgeon with over 14 years of experience, specialized in a single visit painless root canal treatment and
Mhm.
smile designing. What sets her
Excellent.
apart is she has performed more than 6,000 I'm saying 6,000 successful root
Wow.
canals and has crafted countless confident smiles.
Wow. Dr. Zina must be
And
must be doing a great job.
and she
Thank you. Thank
also
you very
blends precision, technology, and artistic to make every smile truly stand out. So, welcome to the channel, Doctor. We have pleasure to have you today on our channel.
Thank you, Seema. Hey, Seema. Hello, Sanjeev.
Hello.
I'm so excited to be here, and it's even more exciting for me to talk about, teeth, which is my favorite topic.
Oh yeah, yeah. Of course, we know how you are passionate about this topic because you must be dreaming about your morals and policies, don't you? I'm very not dreaming about it all your life.
Yes, yes, I'm very guilty as charged. But trust me, our teeth and gums, they say a lot about our overall health, especially for women.
So, one thing, doctor, tell me why oral health matters so much, especially from a woman's perspective. I'm talking. Why does it matter so much for a woman during her pregnancy? And
That's a great question, Seema. See, women go through a lot of hormonal changes, especially during puberty, pregnancy, menopause, all of which can help, it can affect their gum health. For example, during pregnancy, there is no gum bleeding and inflammation. These are very common because of hormonal shifts.
Mhm.
So, you know that, many of them, have you experienced bleeding during your pregnancy, bleeding gums?
Yeah, sometimes.
Many of them think that's fine to have bleeding, but this can be prevented.
Okay. So I was not aware that, bleeding comes during pregnancy. It's something that we don't get it checked. Even when I was
Yes.
pregnant, I had this bleeding gums, but I never got it checked, doctor.
Yes, exactly. See, this is called as pregnancy gingivitis. So managing it early, it prevents the gum disease, which can even influence birth weight or even premature delivery in severe cases. So oral care is just, it isn't about just cosmetic purpose. It's connected to your systemic health as well.
Oh, wow. I
Mhm.
didn't realize that, dental issues affects baby's well-being, and this is really an eye-opener for me. I was
Yes.
not aware of
Yes.
this. Sanjeev, were you aware of it?
No, I wasn't. I wasn't aware of it. This is quite
I
an eye-opening, Doctor.
First
Doctor.
time I'm hearing it.
Really, really. In fact, I will ask my wife as well that what exactly she experienced during her pregnancy. I didn't know anything about it.
So, what can women do to prevent, or what can anybody, not only women, but what can people do to prevent dental problems?
Just by following simple habits, it can make a huge difference. I'll just tell you five quick, simple tips. By just following that, you can prevent major dental issues. First one, as most of them know, brushing twice a day, just for 2 minutes, using a soft or a medium bristle brush. Most of them know it, but many of them just do it single, and they think night brushing is not a mandatory thing, but it is. And the second thing is flossing or using of interdental brushes, which 90% of them whom I've come across in my clinic, they don't do it. It's just 10%, 10 to 20% of them are aware that it should be done. And many of them, even after knowing, they don't find time to do it. And the third point would be, you need to limit your sugary snacks and acidic drinks. This affects your, oral health a lot. Then a fourth point, which is very simple, is by sipping water frequently. It helps wash acids away, which maintains the pH of your mouth and it prevents cavity. Then last but not the least, the fifth point would be to, not skip your dental checkups. You need to visit your dentist every 6 months.
Oh, is it? Okay, I didn't knew this. Thank you. Sipping water helps cleanse your acids. This is something new. Thank you so much, doctor. And then a big
What's the number
confession.
three actually, doctor? What's the number three, the third point you raised? Sorry
Sugary.
to.
The
Limit
third
sugar.
point was limiting sugary snacks and acidic drinks.
That's a challenge for me, doctor.
Sugary
Thank you.
snacks are
Yeah, thank
anyways
you.
not
Very
good for
fruity.
your overall health. It's
I
not only for your tooth, anyways, not good for your overall health.
I know.
And I think one confession from my side also. I've been missing meeting the doctor, dental doctor. I think it's been more than 3 years. I've not even visited a dental doctor, so that's a big confession from me.
What is the thing, what was limiting you from, meeting the dentist?
Oh, maybe there's no problem. Everything is fine. So I'm thinking like,
Um,
when there's a pain, we'll go, right, to see a doctor. Otherwise, we don't want to go, right? That's limiting me,
yes,
nothing else.
yes, that's the mistake which most of them do.
Yeah. So, as you said, like, what do you say that, sometimes skipping fossiling is also a really big deal, right?
You mean flossing?
Yeah, flossing.
Yes, yes, that's a classic confession, Seema. See, think of brushing as cleaning, only 60% of your mouth. The remaining 40% is between your teeth, it needs flossing. So skipping that part, it allows the bacteria to, party inside secretly into your mouth, and
Mm.
until one day that cavity is out, and that's when you rush to the dentist when it hurts.
So it's like having a guest who never leaves our house.
Yes, exactly. And they bring friends, your plaque, bad breath, etc.
Oh, okay. Okay.
So just a quick since we have talked about habits and real concerns. So
Mhm.
now let's clear some confusion about because of there are so many dental myths floating around.
Mhm.
Uh, is it okay if I ask you some fun questions and fun round and some common dental myths
Yeah,
and
sure.
discuss
That'll
it?
be great. That'll be great.
Yeah. So let's understand that if the teeth aren't hurting, I don't need to see a dentist. Is that the right one, or do you think it's a myth?
That's a big myth, and that's the most common myth. Because
Hmm.
tooth decay and gum disease, they usually start silently. By the time it hurts, the damage is already major. So
Oh,
preventive visits, it can catch early signs. So it's easier for you, it's
okay.
cheaper, and it's painless.
Oh, excellent. The second one, I was thinking that if most of the time it happens that we select toothpaste, which you say is that whitener or whitening toothpaste can make your teeth sparkling white. Man, what exactly, which kind of toothpaste we should select, and is this true?
You should always go for a fluoridated toothpaste that prevents cavity. See,
Mhm.
whitening toothpaste, it does not make your teeth white. It just removes the surface stains. It cannot
Okay.
change your tooth color. For, to change your tooth color, you require professional whitening or cleaning that gives real results.
Mhm. So when you say fluoridated toothpaste, in simple
Mhm.
language or simple words, can you explain it? मतलब उसको हिंदी में बता सकते हो और English में भी, so then
Okay.
every walks of people will understand this in a
या
simple way.
श्योर तो वेन एवर यू आर बाइंग अ टूथपेस्ट, जब भी आप टूथपेस्ट आप खरीदते हो तो आपको जस्ट फ्लिप करना है, उसके इंग्रेडिएंट्स देखना है। इंग्रेडिएंट्स में अगर आप उसमें फ्लोराइड कंटेंट देखते हैं, उसमें लिखा होता
Okay.
है सोडियम मोनोफ्लोराइड फ्लोरोफॉस्फेट,
Okay.
उसका 1000 या 1500 ppm लिखे रहता है, पार्ट्स पर मिलियन। तो
Okay.
दिस मच हैज टू बी देयर इन योर इंग्रेडिएंट्स। देयर आर मेनी टूथपेस्ट विदाउट दिस। So without this,
Mhm.
when you use, you don't get this anti-cavity, treatment,
Mhm.
anti-cavity protection from your paste.
Okay. And there was always, we have been told, and even as a kid, sometime
Mhm.
brushing harder your teeth will clean
Mhm.
better. Is that true, or is just light brushing is also okay?
That's totally false. Hard brushing, it damages your enamel and your gums. You need to be gentle. You have to use short
Uh,
circular motions. And you have to think about massaging while brushing your teeth. It's not scrubbing dishes. So, and many of
Okay.
them make a mistake in, choosing the brush as well. So you just, pick any brush which looks good. Color देख के select करके brush लेते हैं. तो ऐसा नहीं
Yeah.
लेना चाहिए brush. तो
So which
brush
one is
लेते
the right one?
brush लेते time में it depends. If for kids, it's always soft brush until
Mhm,
they are like 10 years of age, and
mhm,
then you have to flip over to a medium bristle brush.
mhm.
And when you are around your 35, 40 plus, then depending upon your gum health, we recommend soft brush. Otherwise, medium bristle brush is good for most of them.
Okay, okay,
You
okay.
should never use hard brush. Many of them make a mistake of choosing hard bristle brushes. They think,
Okay.
ज्यादा brush करने से ज्यादा white हो जाएगा और ज्यादा clean लगने लगेगा. Instead, it harms your teeth even more. ज्यादा brush करते करते, I get many patients in my clinic whose
Mhm.
enamel is worn off. You get something called as cervical abrasion. ये
Oh,
क्या होता है?
Oh.
एक डिच जैसे फॉर्म होता है गम्स और दांतों के बीच में, ऐसे क्रेटर जैसे हो
Ah,
जाता है. ये
mm.
मल्टीपल दांतों में जहां पर टूथब्रश ट्रॉमा की वजह से होता है ये. एंड दिस हैपेंस बिकॉज ऑफ रिपीटेडली यूजिंग दिस हार्ड टूथब्रश.
that's good.
तो
Just
इसके वजह से
mm. Yeah, yeah,
इसके
so
वजह से ना सेंसिटिविटी होता है. मल्टीपल दांतों में एक साथ में सेंसिटिविटी होता है, एंड इट कैन ऑल्सो गो फॉर रूट कैनल, मल्टीपल टीथ. सो ऑल
okay.
दीज कैन बी प्रिवेंटेड जस्ट बाय चेंजिंग योर ब्रश.
Just one quick supplementary question, doctor.
या.
You just said that massaging your teeth means simplify this actually because I'm a bit confused that when you say brushing your teeth and what is the difference between massaging your teeth means
यस. सी व्हेन यू मसाज, हाउ डू यू मसाज? मसाज कर रहे हैं हम, ऐसे मोशन यूज करते हैं.
uh-huh,
और ब्रश करने में हम क्या करते हैं? घिसते हैं, ऐसे घिसते हैं. बर्तन को क्या करते हैं? घिसते हैं. तो
okay.
ब्रश हमारे हाथ में दांत के लिए ब्रश है, लेकिन
uh,
ब्रश को हमको स्क्रब को जैसे यूज नहीं करना है. मसाजिंग, वी रिक्वायर वेरी जेंटल प्रेशर ऑन अ टीथ. मसाजिंग के लिए जेंटल प्रेशर चाहिए ना.
uh,
स्क्रबिंग के लिए हमको घिसने के लिए ज्यादा प्रेशर चाहिए. सो इट
right.
बेसिकली मीन्स जेंटल प्रेशर ऑन योर टीथ.
Okay, okay, okay. And you did talk about the dental treatment about pregnancy. Do you want to enhance some more or enlighten me us more? Because now I'll certainly be questioning my wife as well. Means थोड़ा सा और इस पर डिटेल कर देंगे तो अच्छा रहेगा.
हाँ, yeah. See, many of them think that during pregnancy, dental treatments are unsafe. नहीं करना चाहिए कोई dental treatments. See, in
Mhm,
fact, basic dental checkups जो है and cleanings, they are very safe during pregnancy, and they are
mhm,
highly recommended as well. See, only
mhm,
some of the procedures, elective procedures जैसे cosmetic procedures हैं, they can be postponed. जो
mhm,
infection related नहीं है, they can be postponed. But your basic checkups and cleanings, it is recommended and it is mandatory actually during pregnancy, or when you
mhm.
plan pregnancy to be done, so that you have healthy gums. And healthy gums means healthier pregnancy.
We
Excellent.
do have a lot of problems during pregnancy, right? During pregnancy, women have a lot of dental problems. I
Yes,
think that's my
yes.
personal experience as well. When I was pregnant, I did have dental problems, and I was told not to take any dental treatment during that time. So that's a myth.
Yes, that's definitely a myth. You have to do preventive measures so that your gums are safe, because hormonal changes की वजह से हमारा गम्स में इन्फ्लेमेशन एंड ब्लीडिंग गम्स होने के चांसेस वेरी हाई होता है प्रेगनेंसी में. सो इफ यू डू प्रिवेंटिव मेजर्स, इफ यू हैव डन योर क्लिनिक, इफ यू हैव डन योर चेकअप्स, एंड इफ यू आर मेंटेनिंग योर ओरल हेल्थ जस्ट द वे योर डॉक्टर हैज टोल्ड you, then definitely you can prevent your gum problems that can happen during pregnancy. And I think I forgot to mention about the things that can happen if you get gum problems during pregnancy. You can get a low birth weight child,
Okay.
and
Premature
you
baby.
can also have a premature baby.
Okay.
So this many of them don't know.
Don't know this. Yeah, true.
Yes.
So, yeah, that's what about pregnancy. I think I also wanted to check with you, how does menopause affect our oral health? Many of our, I think, my friends, especially, they are into this menopause period now. So, how does it affect oral health?
Yeah, see, during menopause, the lower estrogen levels can cause dry mouth, burning mouth sensation,
Yeah.
gum recession, and even bone loss around the teeth. So, this increases the risk of tooth mobility, and it can also cause a lot of gum diseases.
Mm.
It's so scary.
Very-
Many women do. It's so scary.
Yes.
Many women don't even connect menopause with dental issues.
You
We
don't have to be scared, Seema, because see, regular dental visits during this phase, it's very crucial and it can prevent you from a long-term damage.
Oh, I've heard so many videos or so many talks, menopause, mood swing, menopause, body change, menopause, hair fall, and so many things. But dental, how it affect dental, I think, thank you for bringing this topic today. It's very nice to understand menopause and health.
This
Uh,
is
Yeah.
actually the most missed topic.
Best
Most of
topic.
them,
Yes. Yes.
they actually think ऐसा कुछ होता नहीं है. जब
Uh,
होगा उसके बाद ही डेंटिस्ट
आगे
के पास
जाएंगे.
पहुंचते
सही बात,
हैं.
सही बात.
Exactly. I have a question actually, doctor. I mean,
Mhm.
we mostly we don't hesitate to talk about, but
Uh-huh.
everyone is worries about is
Yeah.
bad breath.
Yes.
Any
Yes.
why people are embarrassed to talk about, and what is the real cause of it actually?
I get many patients in my clinic, who complain of bad breath and they come to the clinic. And when I examine them out, the first thing I see is there's a lot of plaque buildup.
Mm-hmm.
And some of them have gum diseases. There can
Mm-hmm.
be different problems because of which there is a bad breath. They fail to analyze their mouth and then they think it's some other systemic cause जिसकी वजह से bad breath हो रहा है.
Mm-hmm.
Very simple thing, simple way we can, just by maintaining your oral hygiene, the problem
Mm-hmm.
is solved. See, bad breath, it starts in the mouth. First is
Mm-hmm.
through the plaque, can
Mm-hmm.
cause through the gum disease. It
Mm-hmm.
can cause because of the tongue bacteria. It can
Mm-hmm.
also cause because of dry mouth. Sometimes it is linked to, some stomach issues and even dehydration. But 90% of the time, it's always your bad oral hygiene that can cause bad breath. Better
So,
oral hygiene will solve it. Yeah.
so you recommend that tongue cleaning is important as well?
Yes, yes, it's very important because the tongue holds the most bacteria and
Mm-hmm.
more than even your teeth. So a tongue scraper once a day, it can, dramatically improve your breath.
No, that's really useful. Thank you very much.
You're most
Yes, very
welcome.
I
eye-opening.
think
Yeah.
tongue cleaner and all. I remember my
Mm.
mother and dad used to eat, but these days I don't think any one of us use at home also. I've not been using it, so I think now I will start using it after listening to you, doctor.
There is a lot of, awareness there is a lot of, I think
Yes.
there is lack of awareness in this particular field because of which we end up in problem. Most of them I get in the clinic are always in the treatment phase and they are not in the preventive. Out of 100, I can say people who come are 90% come in the treatment phase. जहाँ पर प्रॉब्लम हो चुका है और उसके बाद आ रहे हैं आप ना, तो प्रॉब्लम
Mm.
होने से पहले तो there are some people who are aware and really, उनके health को and they take care of their oral hygiene and their health so much that, even they want to prevent something happening. So they come frequently for a checkup. That is just, I can say, 5 or 10 out of 100. But most of them end up, so I sit and, create awareness for each and
Ah,
every patient कि
mm,
बोलते हैं कि आपको करना है चेकअप every 6 months करना है. But see, when, most of them fear dentistry, what I see is one major thing is, looking at those instruments, the drilling sound and
mm.
getting an injection in your mouth. This is what scares you the most, first
True,
thing.
true,
And
true.
second is the cost. Many of them fear the cost. It's like बहुत expensive है, बहुत खर्चा हो जाएगा. Like जब प्रॉब्लम आते हैं तब देखते हैं ना, मतलब अब तो कोई प्रॉब्लम नहीं है तो फिर क्यों जाने का है?
Correct.
But you know
Yeah.
what? Dentistry is not expensive. Negligence is. This is what I tell most of my patient.
We
The
pay for
more
the
you
negligence.
neglect,
We pay for
yeah,
the negligence.
the more you neglect, the more you have to pay for it. So prevention up करने से you are on the safer side always.
Yeah.
What is one last message that you want to give to people to remember?
I just want to say that your mouth is not separate from your body. Taking care of your teeth and gums is an act of self-care and it's not luxury. So a healthy smile is a powerful smile. That's my word.
Oh, love it. I love it. So thank you so much
So,
for sharing the
thank you, doctor.
message.
Thank you, doctor,
You're
very
most
much.
welcome,
Quite
Seema.
eye-opening information you've shared. So, thank you very much.
Thank you, doctor.
Thank
Thank you so much.
you.